Hello and welcome to Pharmacy Pearls. I'm Greg Cummings, pharmacist and certified diabetes educator. For people living with diabetes, testing your blood sugar levels helps you judge how your body is responding to food, activity, and medications. Doing so requires a tiny drop of blood, usually taken from the fingertip, using a lancet with a spring-loaded needle. And while today's lancets are extremely fine, making testing virtually pain-free, here are some tips to help you avoid discomfort associated with repeated fingertip testing. Don't use rubbing alcohol. It's important to have clean hands before testing, as food on your fingertips could contaminate the blood sample. But cleaning with rubbing alcohol is not only unnecessary, repeated use will thicken the skin and make lancing more painful. Simply wash your hands in warm soapy water. After testing, don't wipe the lancet with alcohol, as alcohol breaks down the silicone coating on the needle that makes it slip easily into your skin. Get the blood flowing. In order to get an adequate blood sample, do you find yourself squeezing the blood out of your fingertip or using a deep puncture setting on your lancet? If so, try improving the flow of blood to your fingers before lancing. Use warm water to wash, then let your arm hang down at your side for a minute, or gently massage your finger from base to tip. After lancing, firmly press a clean tissue to the site for a few seconds until the bleeding stops in order to prevent bruising. Experiment with different devices and lancets. There are a variety of different lancing devices and lancets on the market. Talk to your diabetes educator about which products are best for you. Many companies give educators free samples for clients to try. Use Lancets Once. Using lancets makes them duller. For the least amount of discomfort, use a lancet only once. If you have to reuse lancets because of their expense, limit each to 2 to 4 punctures maximum. Try a shallower puncture. The deeper you lance, the more nerve endings you touch. Use a lancing device that allows you to dial the depth of the puncture and select the lowest setting that gives you an adequate blood sample. Pick your site. Avoid repeated testing in the same spot by alternating among all your fingers. Target the sides of your fingertips rather than the soft center area. The sides have more blood vessels and fewer nerve endings, giving you an adequate sample with less pain. Although some lancing devices allow you to test in alternate sites, such as the forearm or thigh, the results from these sites may not be as accurate as those from fingertip testing when blood sugar is rapidly changing, such as after meals, physical activity, or medications or insulin injections, or during low blood glucose. Talk to your diabetes healthcare professional about whether alternate site testing is right for you. Use lotion. Using hand lotion regularly will help soften your fingertips and make testing easier. Make sure you wash off the lotion before each test. Talk to your diabetes educator. If you are still experiencing pain with fingertip testing, consult your diabetes educator. He or she can help ensure that you are using the right products and techniques for you. That concludes this edition of Pharmacy Pearls. Be sure to subscribe to my YouTube channel so that you never miss a video. For additional content, you can read my free weekly newsletter at pharmacypearls.com/letter. Thanks for watching.